Hi everyone, Aaron Brooks with Perfect Postures, and this week's Ask Aaron question actually had to do with low back pain. We get a lot of low back concerns or clients asking about their low back issues. Obviously, when you look at the statistics, over 80% of Americans have or have had low back pain. So that in itself is an epidemic. That's not including mid back pain or neck pain or knee pain. So think about that, 80%. So a lot of the posts that we do are in regards to low back pain. This one that I want to talk about is actually quite interesting though, where we actually look at how the foot can alter the knee position, which then alters the hip position, which then alters the pelvis and low back position. So we had a client come in with his right foot was turned out significantly, and part of the reason was that was a compensation. He had broken his ankle 7 years ago, and then basically it's like clockwork. He has to go to his chiropractor every 3 months to get an adjustment. So when I did the evaluation, his right foot was really turned out. His ankle was completely collapsed in, so he was actually pronating at his subtalar joint. So what happened was, as it turns out, his knee collapsed in, and then it was actually almost depressing the right side of his pelvis. So what happened was he actually created a leg length disparity between his right and left side. So his left side was actually high, and his right side was actually low. So it was kind of collapsing in this way. So one of the things to look at, if you just stand in front of the mirror, look at the position of your feet. You may want to even close your eyes, just march in place a few times, and then when you stop, look down at your feet and see where your feet are pointing. If one foot is actually pointing out more than the other, the foot that is pointing out, typically the ankle on that side is going to start collapsing in. So that could be a huge factor into why you may be having low back pain. So stay tuned for the corrective exercise of the week. We're going to actually show you an exercise to address that foot and ankle issue.